Well, good afternoon, everybody. I know this hour stands in between you and a break, so I challenge you to pay attention and still really engage in the conversation and great dialogue and stimulated conversation we've had earlier. Physical health issues. Oh, sorry, I'm Dr. Leslie Walker. I am a professor of pediatric and adolescent medicine at the University of Washington, and I'm moderating the physical health issues program today. I think especially being the hour before the break, people may think this is a really straightforward issue. You just kind of need to gloss over because, young adults are the healthiest group that we have in the country. And I want you to listen and really pay attention, and I challenge that because it's not so straightforward. And in fact, there's probably still a lot we need to know about young adults and their health status. But there are three things that I think we need to think about while our speakers are talking. One, that physical health it may be that young adults are more resilient at that time, but there still are health issues that affect many, and it affects their ability to negotiate and be successful in whatever milieu or environment they find themselves in as young adults. Secondly, greater than 90% of children with chronic diseases now live to adulthood, which means that they have to transition into adulthood. And what that means for many can be very rocky and very treacherous for them and their families. Thirdly, health inequity. You have to think about, when you're talking about health status and physical health in young adults, health equity and the resulting health disparities becomes an issue and a concern. And how we address that for many also makes a difference on the trajectory and what's going to happen to them as they move through adulthood. So keep those things in mind as you hear from our wonderful speakers. And our first speaker is Dr. Larry Neinstein, who is a professor of pediatrics and internal medicine at the University of Southern California.